All right, today let's talk a little bit about subclinical hypothyroidism. So my nurse practitioner asked me this question. If a patient has a normal TSH, a normal T3, normal T4, but very elevated anti-thyroid antibodies, how do we decide whether we should treat or monitor? So let's briefly discuss how the thyroid works. The hypothalamus and the CNS, the central nervous system, produces thyrotropin releasing hormone, which goes to the anterior pituitary and activates the release of thyroid stimulating hormone, which is TSH. The TSH goes to the thyroid gland's follicular cells and prompts them to produce thyroglobulin, and it also activates thyroid peroxidase, which is TPO. TPO facilitates the reaction between thyroglobulin and iodine to produce iodinated thyroglobulin. Iodinated thyroglobulin is cleaved, and the two thyroid hormones are created, T3 and T4. T4 is created in larger quantity, but T3 is actually the more active form of thyroid hormone. Both T3 and T4, these thyroid hormones, are highly bound to plasma proteins. And you can think of the bound form of these thyroid hormones as like a storage pool. So the active, the free thyroid hormone is what can go into cells and causes the reactions that facilitate the metabolism that we need to carry out our life functions. So I won't go through all these labs at this time, but I would like to point out that the TSH is what is used to screen thyroid function. So if it's normal, there's a great chance that your thyroid function is okay. And it's what a lot of doctors and nurses and providers use as just a baseline screening, the TSH. However, I have a lot of conversations with my physician assistants and nurse practitioners about various phenomena that we're seeing. And one thing that we have noticed is that many patients post-COVID, post-vaccine are presenting with signs and symptoms of low thyroid. So she is doing more than just a screening TSH. She's also drawing thyroid hormone levels and anti-thyroid antibodies, specifically anti-TPO. And she is noticing that many patients that technically have normal thyroid function are symptomatic and are showing evidence of thyroiditis. So this is called subclinical hypothyroidism. So thyroid disease is very common. It affects about 10% of the population, women more than men. Prevalence increases with age. There's a genetic predisposition. There are triggers, stressors, including infection. Yes, COVID can trigger some thyroid issues. And there are algorithms that help you decide what to look for, who to treat, and when to treat them. And this is one such algorithm. And you can see here that if the TSH is less than 10 mu per L, the decision to treat is a bit nuanced and based on other factors such as age and symptomatology. But to answer her question about whether or not we treat these patients that have a normal TSH, normal T3, normal T4, but they have positive anti-TPO or positive anti-thyroglobulin, what do we do with this subclinical hypothyroidism? So if the patient is pregnant or trying to conceive, we would treat. Low thyroid levels are associated with worse fetal outcomes and infertility issues, so we would want to treat that. If the patient is symptomatic, we'd want to consider treatment. The caveat here is sometimes patients will have symptoms that can be associated with hypothyroidism, like fatigue or hair loss, but that's really not what's going on. That's not the problem. That's not the source of their problem. So treating it won't do anything. But if they have normal thyroid function tests, are asymptomatic, meaning they have no symptoms, and the only thing that was picked up on lab is the anti-TPO or anti-thyroglobulin antibodies, monitoring is probably appropriate. And I say this because I always tell my PAs and nurse practitioners, when we see patients, we see patients. We treat patients, not numbers. So always consider the individual person and tailor the treatment to their unique set of factors, which includes way more than can be demonstrated just by looking at numbers on a piece of paper after we draw their labs.